I said, okay, well, is everything okay with my labs? And she said, oh yeah, everything's fine, we just have one problem. And I'm like, okay, what's the one problem that we have? Is it diabetes? Because I had gestational diabetes with my 8-year-old. She's like, well, no.
Yeah. My name is Momobolale Olatoja. I'm here this afternoon to present to you HIV/AIDS. You can take a look at this picture. Seeing this lady, you will never know she's an HIV positive. She looks like a normal person like we do. I'm here this evening to tell you that she's HIV positive. Actually, sometimes we come across a lot of people that we don't know they are carrying these diseases in their body. And I'm going to discuss about how we can prevent this and how to talk to your doctors maybe when you have HIV or you have somebody that is being bothered about HIV. HIV is defined as an acquired immune deficiency syndrome. It is an infectious disease caused by human immune deficiency virus. There are two types of HIV. We have HIV-1 and we have HIV-2. Both are all ultimately cause of HIV. HIV can be contacted through fluid. Normally before we get HIV through blood, but now from the research, HIV can be contacted through fluid, from human fluid. Fluid means maybe like somebody body fluid dropped on the table and the person, maybe the oncoming person doesn't really know. When you touch it, or maybe you mistakenly touched where the person has left, you can get contaminated with HIV. Another way is when we don't protect ourselves. Unprotected sex is another means of getting an HIV. Maybe through vaginal sex or through any oral means. HIV is a microscopic viral disease that everybody can see with their naked eyes. Another means of getting HIV is maybe when a pregnant woman, when you don't know, when a pregnant woman that has a baby in their stomach, like a pregnant woman, a child can get HIV through the mother, especially when the mother is breastfeeding. Breastfeeding through the immunic fluid, that is when a child has HIV. Someone also can get HIV through exposure of contaminated blood. That is one we just discussed about sex. There are several ways the government have encouraged a lot of HIV patients to come for a test, talk to your doctors when you have an HIV. Like maybe if you don't know, sometimes it's good to go for medical checkup. When you go for regular checkups, then you can find out that maybe you are HIV positive or you have AIDS. Actually, differentiating HIV and AIDS is a two different things. The first stage is early stage. That is, we have two stages: the early stage and the late stages. The early stage is the one that we can be detected between 2 to 6 weeks. Then for early stage, the symptoms include when we have fever, joint pains, sore throat, rashes, headache. Those are the first stage. The second stage, which is the last stage, that one does not get treated for HIV. It automatically leads to AIDS. Maybe like after 10 years, when we don't treat ourselves, then it's actually from HIV goes to AIDS. These are the symptoms include maybe like a night sweat, diarrhea, shortness of breath, extreme weight loss, coughing, feeling so tiredness. Those are the major things. When it gets to this, that is the last stage, which is automatically AIDS. Then there are also 3 important precautions that we should know. Anyone that is going to be like in a hospital settings, we should always use a glove to protect ourselves. We don't touch other people's fluid with our unprotected hands. Another means again is having unprotected sex. We should always use a condom with our partners. Then we should not have multiple partners. When an individual has an HIV, it is better when you have a single partner. That can easily be detected than having multiple partners, because you don't know whom you're getting it from. In conclusion, I would like to overcap all the things that I said, that we should always take precautions. Precautions are better than cure. When we take proper precautions, HIV can be reduced, it can be protected. Thank you. Does anybody have a question? All right, thank you so much. Have a great day.